I will present myself first. I'm Dr. Saoussen from the University Hospital of Monastir, Tunisia, and I am going to represent today my work entitled Eating Disorder During the Covid-19 Pandemic, the Maghrebian Experience. Introduction. The coronavirus pandemic is considered the worst hit that the world had witnessed in centuries. The impact of the pandemic, especially during the lockdown, was not only diverse but also worldwide. The African continent, including the Maghreb, had its own peculiarities while dealing with this pandemic. The lack of information about the emotional impact of the COVID-19 pandemic on eating disorder symptoms was a motivation to investigate the Maghrebian experience. So the aim of the study was to assess levels of anxiety and eating behaviors in Maghreb during the COVID-19 pandemic and to evaluate possible correlations between the two entities. For methods, the present study is a cross-sectional study that included the population of 3 Maghrebian countries, Tunisia, Algeria, and Morocco. Data were collected in an online study administered via an electronic self-report questionnaire published in several social media groups. The questionnaire, the study was conducted from April to July, and participants were eliminated if they were under 18 years old or poorly completed answers. The participation was voluntary. The purpose of the study was explained, and the confidentiality and the anonymity of each answer was ensured by the investigator. A self-report questionnaire that took approximately 30 minutes to answer and collected data on socio-demographic, age, sex, marital status, number of children, etc., participant history, addictive history, clinical history, weight and height, weight management strategies. And we use 3 questionnaires. We'll start with the first one, the SCOF questionnaire, 6, control, 1, fat, food. The SCOF questionnaire is a simple 5-question screening measure to assess the possible presence of an eating disorder. The validation study of this version demonstrated a positive predictive value of 65%, a negative predictive value of 99%, and sensitivity and specificity approaching 95%. The 5 items assessed in this questionnaire are related to loss of control over eating, weight loss, induced vomiting, intrusive thoughts about food, and body dissatisfaction. Each yes equals 1 point. A score of 2 indicates likely diagnosis of eating disorder. The eating disorder inventory, the EDEI-2. The eating disorder inventory is a self-report questionnaire discriminating reliably between patients and non-clinical control. It contains 91 items on 11 dimensions, but we have only explored 4. Bulimia, body dissatisfaction, ineffectiveness, and perfectionism. The last questionnaire is the hospital anxiety and depression scale anxiety, the HAT-A. The HAT-A is a simple tool used to estimate generalized symptoms of anxiety and fear. It is a screening measure for clinically significant anxiety and depressive symptoms in people with physical health problems. The diagnosis of anxiety was confirmed if the total score is over 11. It is rejected when the total score is less than 7, else it is considered as borderline. The statistical analysis data was collected and enrolled in Excel. The statistical analysis was realized with the help of SPSS version 24. Ethics consideration. The purpose of the study was explained. The confidentiality and anonymity of each response was guaranteed. A completed questionnaire was considered consent to participate in the study. We get to results in our study. 58 participants responded to the survey. 2 questionnaires collected were rejected because they were incompleted or incorrectly completed. 2 participants were cancelled because the age was less than 18 years old. A total of 754 usable questionnaire was retained during the survey. For the socio-demographic characteristics, Tunisian participants represented 79.6% as 600 participants. Moroccans and Algerians represented respectively 10% and 10% each. More than half of participants were single, and 22.7% were married. 17.8% had children, and 85% had a moderate socioeconomic level. 72% of participants were in lockdown during the study, as 50% had a job and 44 were students. For comorbidity, almost a third of participants had diabetes and dyslipidemia. The addiction habits were surprising, as 85% and 78% admit respectively using tobacco and alcohol, while only 38% were consuming drugs. Coming to eating habits, starting with the BMI classification of our participants, slightly more than half of participants had the normal body weight and only 8.5% had obesity. Half of participants do not use any body weight management techniques, while the third exercise and 6% fast. In general, 8% had eating disorder history. Coming to the interpretation of our 3 questionnaires, getting to the major elements of our study, eating disorder and anxiety. Eating disorder represented 45.9% of the sample. The anxiety levels were divided to half non-anxious and 2/3 between anxious and borderline cases. Returning to the eating disorder inventory, bulimia varies between 0 and 21 with the mean of 3. Body dissatisfaction varies between 0 and 27 with a mean of 12.7, while inefficiency varies between 0 and 30 with a mean of 9.4. We try to identify the main prognosis factors for eating disorder. The selected factors were the following: gender, with P equal to 0.008, BMI, body mass index, P equal to 0.011, anxiety, P equal to 0, bulimia, P equal to 0, and body dissatisfaction, P equal to 0, perfectionism as well, and inefficiency. In a multivariate analysis, statistically significant prognostic factors for eating disorder were gender, underweight, anxiety, bulimia, and body dissatisfaction. The presence of um, the presence of perfectionism and efficiency were a dependency associated with anxiety, while the marital status was also a statistically significant factor. Going to discussion, eating disorder during the COVID-19 pandemic. Past research has shown that Maghrebian countries follow the rest of the world in the prevalence of eating disorders in the pre-pandemic period. In fact, 19% of Tunisian students suffer from eating disorder, a huge number comparing to Algeria that counts only 6% presenting risk of eating disorder. The study shows that during the pandemic, there was a rise in number of people with eating disorders spread over the three Maghrebian countries, reaching up to 45.9%. This rise goes along with other surveys in different parts of the world, such as Italy, that witnessed an ascent of double in binge eating behavior, side to side with Australia, that reported 34.6% increase of binge eating behavior. However, this remarkable evolution in eating disorder during quarantine didn't come out of nowhere. Many reasons were implicated. The available literature incriminates the food and security mechanism with the threats of food shortage and the multiplied number of meals organized per day due to the excessive feeling of boredom and loneliness resulting from social distancing. This rise of cases related to eating disorders can as well be triggered by the post-trauma feeling exacerbated by the overwhelming overthinking about insecurity, not only in absence of treatment protocols, but also in the onset of a serious economic crisis. Anxiety during the COVID-19 pandemic. Up to 25% of world population suffer from anxiety disorder. According to the CED questionnaire, 10% of Tunisian participants matched the criteria of anxiety among 1,246 participants. Morocco scored 9.1% for anxiety and 26.5% for depression, while 23.3% of Algerian population is anxious. The female predominance was found worldwide. These numbers tend to rise even more globally and locally. During the coronavirus pandemic, in a systematic review and meta-analysis on July 2020, results have shown that the prevalence of anxiety has reached 31.9% and the prevalence of depression is 33.7%. This global rise proves that the Maghreb is no exception, as anxiety reaches 26.8% of the population studied in this survey. Anxiety can be explained by the fact that 72.9% of the population participating in the study were in lockdown, the limitation of the daily activity and the imposed disrupted routines seem to be a trigger for anxiety. The main question of the study is willing to answer whether there is a link between anxiety and eating disorder or not. The study shows indeed a significant correlation between these two entities, P equal to 0.001. This comorbidity has long received a lot of attention in the literature. However, the cause-effect relation has not yet been well understood. Some studies suggest that the onset of the anxiety disorder precedes the onset of the eating disorder, and that treating anxiety is an important step in the cure of any eating disorder. While other studies blame the eating habits for most of the psychological health troubles, proving that dysbiosis and the inflammation of the gut are linked to several mental illnesses. Proposing, on the other hand, probiotic, simple eating habits, modification, and diet as key solution for anxiety and depression problems. Ending with limitations, Overall, we acknowledge some limitations to the study, as the sample used is not enough big to be statistically representative of the Maghrebian population, and most important, it is not equally distributed between the three countries. Furthermore, the question should have been more precise and more open to variables, given an example, the impact of media on mood and on eating habits. In conclusion, this is the first study in Maghreb that highlights the period of quarantine and its repercussions on anxiety and eating habits. 26.8% of the Maghrebian population was found anxious, while 45.9% were at risk of eating disorder. Even though the study acknowledged some limitations, a significant correlation between the two entities was proved. As this pandemic doesn't seem to have any end any sooner, the study comes to open the gate for further and larger studies to confirm or reject our hypothesis in order to come up with solutions to this issue that seems to be so far an international dilemma.